Alright, in this video we will be discussing about Wernicke's aphasia. We have already discussed the basics of aphasias. Now, starting with the first particular aphasia, that is Wernicke's aphasia. What are the clinical features of Wernicke's aphasia? Comprehension is impaired for spoken and written words and sentences. Right? Repetition, naming, reading and writing are also impaired. Language is fluent but highly paraphasic. This is the only thing that you have to remember mainly. That is the only thing which is left in Wernicke's aphasia. Otherwise all the modalities are involved. Fluency is maintained. The speech is fluent, fluency is maintained, but the patient is not able to comprehend, patient is not able to repeat, not able to name the things, not able to read, not able to write. Right, but he is fluent, he will speak something, he will speak incomprehensible words. That is what is written in here. He will speak incomprehensible words, and he will appear angry and impatient when the examiner fails to decipher the meaning of a severely paraphasic statement. Right, patients with Wernicke's aphasia cannot express their thoughts in meaning appropriate words and cannot decode the meaning of words in any modality of input. Right, neither they are able to understand what the examiner is saying, or and nor they are able to tell the examiner in a meaningful language. Right, the patient's comprehension, patient's speech is so much impaired, means the meaning of the words is so much impaired, they are not able to choose the appropriate words. They are trying to express their thoughts through the language, but the words that they are choosing, they are very much inappropriate, to such an extent that the total speech becomes a jargon. Right, remember the word jargon. The speech becomes jargon because the words are totally incomprehensible as told by the patient, nor they are able to understand what the examiner is saying. Because why? Because comprehension is impaired, they are not able to understand what someone else is saying, neither they are able to express themselves. At the same time they are not aware that they are impaired, they have an impaired language, language, or they have impaired speech. They do not know that. What will that cause? That will cause, you know very much, that will cause very much anger in them, that will cause very much frustration in them, that why the other person is not understanding my speech. Right, they are not able, they are not aware of the deficit that they are having. So this is the kind of aphasia, this is the kind of Wernicke. It is very important because it is a typical presentation, and it tells us about the inferior division of middle cerebral artery involvement. Coming on to the next slide. What is the etiology? Embolus to the inferior division of the middle cerebral artery, to the posterior temporal or angular branches in particular, is the most common etiology. Otherwise, intracerebral hemorrhage, trauma, neoplasm are other causes of Wernicke's aphasia. A coexisting right hemianopia or superior quadrant anopia is common, and mild right nasolabial flattening may be found. Otherwise, examination is unrevealing. Right, because temporal lobe is involved in basically memory, it is involved in basically speech and language. It is not involved in any motor activity, but a little involvement is in the vision, because the lesion can cause superior quadrant anopia, and sometimes seventh nerve is involved, and mild right nasolabial flattening may occur. Prognosis for recovery of language function is guarded. Right, this is very important. Prognosis is not that good because recovery will not happen to any extent once the Wernicke's area is in, because the area is very large. There are so many neurons, so many circuits, so many fibers involved, and once the fibers are damaged, the chances of recovery are very less. Though the recovery may occur in one to two within 1 to 2 months. After that, there will be no recovery, and that too, the recovery that happens is very little. So the patient does not recover. We have to consider that. So that is all about the prognosis of the Wernicke's aphasia. This is all about the Wernicke's aphasia. We will be coming up to the next video. We will be coming, I will be coming up in the next video with the Broca's aphasia and other types of aphasias. So that is all about Wernicke's aphasia. Thank you for your patient listening.